My question is to the Minister for Health, and I refer to the Cook Labor Government's investment to drive positive change in Western Australia's youth mental health sector. And I ask, can the Minister outline to the House how the recently opened youth sanctuary in Subiaco will support young people experiencing suicidal thoughts? And can the Minister advise the House how this facility supports this government's implementation of recommendations by the Infant, Child and Adolescent Mental Health Task Force?
Minister for Health.
I thank the member for Nedlands for her question and for her attendance at both the prior opening, as we launched the, I think it was the redevelopment of the Luma project, and for at the actual opening of the project, and for her actual ongoing support on the ground, particularly with the local council, in getting that project approval at council level. I know that there was some disquiet with residents, and that was a really, really important role that you played, so thank you for that, because these facilities need to be in the community. They need to be in residential areas, and the Luma project is a great example of West Australia investing in different models of care, particularly for young people. We have a strong track record in investing in mental health, with an increase by 50% of the mental health budget since we came to government. But this project opened earlier this month formally by myself and the member for Nedlands, is a short-term residential service for 16 to 14-year-olds who need a safe alternative to a hospital emergency department. And it is mostly run by young people and peer workers, but with oversight from a clinician on site. It provides trauma-informed, person-centred care, and it is a less medicalised support for people, young people in particular, experiencing suicide or thoughts of suicide and crisis. And we know that the drivers of suicide are incredibly complex, and they are very complex in young people, and having the peer worker model is very important. And one of the things that came out very strongly from the Infant, Child Adolescent Task Force, from our lived experience, both carers and individuals, was that they want a stronger peer workforce. They want people who look like them, who've been through their same experience, and who can understand the recovery journey. It's not always a clinical response that's required, it's an emotional and wellbeing response. So they will hold people for a period of days and help support them into another service for ongoing support. And they can come back as required. It's beautifully fitted out. It's a lovely home environment, really nicely done, and I have to congratulate the Samaritans and RUA and the Mental Health Commission for their partnership in delivering this. It'll probably see around 300 people per year through this service, and we'll be watching it very closely. We'll be evaluating it, and certainly expect it to be very successful, and hope to see more pilots like this supported in the future. It strongly aligns with the ICA task force and the government's implementation of those recommendations, and it strongly aligns with the suicide framework, and it strongly aligns with our commitment to reforming the delivery of mental health services, and this is a great example of that reform in action.